know, lots of motivations. When Sherry asked me to talk, it was pretty obvious what everyone wanted to hear since.
Can't hear you, Dr. Ackerley.
You can't hear me? Am I muted because my microphone's...
We hear you.
Okay, great. And you've just lost the screen. So we'll get the screen back and we are fine. Nothing's being touched again. Okay, so you're all seeing COVID-19 update. I should be recording. It says pause recording. So I imagine that I am recording now. And so I'm here to talk about...
I hear you, Dr. Ackerley. I don't know if anybody else can, but I can't.
I think we probably should mute people, Anita.
I will.
And see, you can usually, when there are questions in a large group, Anita jumped in nicely to take over chat, to take over tech support. You can put it in chat, and I'm sure she'll try and work with you here.
Okay, I'm going to mute everybody, including you, Mary. So you're going to have to unmute yourself.
Okay, I am unmuted and I am the speaker now. So, and you should all be seeing COVID-19 update, January 2021. This is me talking, and I'm here to answer, again, the questions everyone wants to know. Tell me about the COVID vaccine. And I want to just give everyone a quick little update of where we are now in Arizona. We've had, this was on Sunday, 1 in 10 in Arizona have had COVID, have actually tested positive for COVID. We assume at least twice to sometimes 10 times as many people actually have COVID. And Yuma is 6th highest in the country, in the whole country. It's 1 in 6 in Yuma have COVID and 1 in 10 in Pima, Maricopa. So that's really high. In fact, we are the highest in the country. In terms of, South and North Dakota beat us, I think, slightly in terms of number of people who've had it, but we still have the highest rate of new infections in the country. So we're living COVID here. And in terms of deaths, just which is the part about COVID that is probably the most frightening, really, is our death rate has been of people who have COVID about 1 in 60. And that is about 10th highest in the country. So again, COVID is a very pertinent topic for Arizona. And there are probably many reasons why Arizona is this high. In United States, it's about 1 in 13, 25 million now tested positive for COVID. And we've passed 400,000 deaths. And in the world, it's actually, we're close to 100 million have tested positive. And the death rate overall is a little higher in the rest of the world overall, 2.1 million. So I just want to put that in perspective. The last time we talked in July, when we had just been peaking and thought that was very high, I think we were like 1 in 100 at that point. So that's how far we've come. And so the vaccine is a very pertinent topic. And about the vaccine, I just want to explain some really research about what we're talking about with SARS. Is some really, really good research has come out recently about how we divide SARS from inoculation, which means you have the virus in you, usually your nose. You are considered asymptomatic. You don't have an infection. You don't have any symptoms. You're carrying it possibly, but you're not sick. Mild in general means, and this is again done at the genetic level using something called metabolomics, which is showing how the genes are expressing. It's fascinating research done in England, but it's very helpful to answer the question, should I get the vaccine and why would I want the vaccine? So if you have mild or no symptoms, essentially you have no inflammation and you have what we call a robust adaptive immune system, meaning it works, okay? It saw a target and either it didn't even let it, basically get past your barriers, or it started attacking it pretty fast as it started trying to worm its way in. The next step would be hospitalization, severe hospitalization, and death. And in that case, you have a weak immune system that could not kill it. It spread through the body. And as the immune system was allowing it to take over, inflammation really kicked in. And inflammation or cytokine storm is a major cause of ending up in hospitalization, ICU, and death. And then the third group of symptoms, or the way the immune system responds, is what we're calling chronic long haul now, or long COVID. And that is where patients are showing inflammation and overactive autoimmune responses. So it's important to understand that everyone can have different ways of reacting, and some of that's going to be helpful to answer the question, should I get a vaccine? And there are references here if you want to check this out. So currently we have 2 vaccines, Pfizer and Moderna. Johnson & Johnson is coming out with one that's expected to be approved in several months, but Pfizer and Moderna is what's available. Both, I think, are available in Arizona. And this is how they work. They are using messenger RNA to essentially enter your cells, your macrophages, right at the site of injection. They're giving your macrophages a instruction set, how to make something called the spike protein. We've all seen pictures of that. And it's making pieces of this protein, the spikes, and the cells after vaccination begin to start making the protein pieces. They're displaying them on more and more cell surfaces. And the idea of all of this is your immune system now has a guide that recognizes the protein doesn't belong there and should begin building an immune response and making antibodies. This is how they work. And that may seem really complicated. It is new, okay? This is a new technology, not used and developed because we've never had a vaccine for SARS viruses before. So how can this go wrong is the question everyone wants to know. And the possible side effects, the most common question is, and everyone has heard, there can be an anaphylaxis, which means the throat closes up and you have problems getting oxygen. And most people think this is related to the coating called PEG, which is actually in Miralax, among other things, that allows the mRNA to actually get into your cells. And that's been observed. And that's usually seen about 15 minutes after you've had the inoculation. And I think that's running about 1 in a million now. And by the way, at this point, we've had 20 million people in the US actually have gotten the vaccine, at least one. 3 million have gotten both their vaccines. And somehow, though, we have 40 million vaccines in circulation. So there's a lot of vaccine that hasn't been used and given, but it's, 20 million is close to 10% of the US population has had at least one, if we have 330 million. So it's being tested as we speak in sense of how many people have gotten it. And this most common side effects are really not the anaphylaxis at all, is the vaccine is designed to make your immune system recognize what's going on with COVID. And so you stay in group 1, you have a robust immune system, you either don't allow entry or you kill it so fast that it doesn't have a chance to start inflammation and bring your body into much more severe illness. You need to grasp that fact. That's why we're giving vaccines, and that's how this vaccine works. So there are very common side effects, and common is what I've heard from people, mostly the first people getting it with doctors, and I'm on doctor lists where people were showing pictures of themselves getting it, but also the front line who worked in hospitals saying these are the side effects they've seen in every trial. It's going to be pain where the shot was given. some fever, certainly fatigue and headache, really common, muscle pain besides the site of injection, chills, and joint pain. And this would be sort of like a mini COVID, essentially, that your body's getting. And it starts to occur usually within 12 hours after injection. And the CDC is saying if these symptoms occur more than 3 days after the shot, you should consider getting tested for COVID. That's longer than we expected to go on. Knowing these are the side effects is you need to know who the government is saying shouldn't get it. It's not been tested in children under 16. Really, I think Pfizer is 18 and above. It's not been tested in pregnant and breastfeeding women, although I will say there are a number of doctors who have been pregnant and breastfeeding who've decided to go ahead and get it, and nothing has been seen that's been reported. And then the question everyone here is asking, we're asked again, is, it is not knowingly being tested in anybody with SIRS, Lyme, mast cell, autoimmune illness, POTS, allergies, chronic fatigue, and filling your condition, EDS. So when I get asked, should I get it? I have no database to give you. I can only reason logically and tell you how it works and hopefully give you the information to make your own decision here. We do know that people certainly have common SIRS is, Lyme, mast cell, autoimmune. All of these things are very common illnesses. So we know lots of people who didn't really know they have it have gotten the vaccine. And so far we've talked about the most common side effect, serious one being anaphylaxis. Deaths, one death has been reported after the vaccine in a doctor to an autoimmune condition, but you have to realize that one death when you've had 20 million dosages is statistically, there's no way you can say that the vaccine caused it, even if you may think the vaccine caused it. We need to see more than one autoimmune illness. And the side effects that are seen pretty quickly really are the ones that I've just mentioned. In some people, they are more severe, and other people are not getting any of them. And I should say the patients who have not had any sort of immune reaction, 91 years old, one person, 78, 83, I think you get the idea from that. People whose immune system doesn't work very well don't get these reactions. And in general, we think, well, that's probably a good idea that they have a vaccine boosting their immune system because their immune system doesn't work. And in truth, after 60, a lot of things stop working, including your immune system, because the thymus by that time is senescent. So that was one of the fun facts I learned this year. Didn't know about that. And that's why the elderly don't do well. And so here are the facts I think you need to know about this is what is it going to do? Why do you want to take this risk? Both Moderna and Pfizer show it's going to give you a 95% chance of not ending up in the hospital or dead, okay? I didn't say it's not going to let you get COVID. I said it brings your symptoms down to mild or asymptomatic. It's an important point to grasp. A lot of people are running around saying it's 95% you won't get COVID. No, no, no. Does not show that. Just that the symptoms are mild or none at all. And most experts, to be honest, they're experts, but nobody really knows what's going to happen. Is theoretically, it should slow down transmission, but not stop it, because you can still be a carrier very easily without knowing it after the vaccine. And in fact, there's an animal study someone showed me recently in mice where they compared vaccinated to unvaccinated, and the rates of carrier mice still transmitting were the same in both groups, okay? So if someone's next to you and says, I'm vaccinated, that doesn't mean you don't wear a mask or distance. They may actually be less likely to know if they're being a carrier. But 95% chance of not ending up in the hospital or dead, that's like a real statistic, and you need to seriously think about it. And again, what it's not going to do is it's this is not a live vaccine, very different. And I think it might be interesting. Some of you people have known me for a very long time. And you know that I don't actively promote vaccines, and I tend to discuss it pretty factually that a number of vaccines may not be worth it in terms of what they give you versus what possible effects to excipients might be. I certainly think that the evidence for no harm in children under 5 getting 60 vaccines is that really a lot more research needs to be done on neurodevelopmental effects. And I think I've shared with some people here that certainly in my own extended family, there are probably at least 2 children who've had reactions to vaccines. So I am not someone who says vaccines, just get them. Don't think about it at all. So it's a little strange for me to be sitting here being asked about vaccines and talking about them. But this really is a different vaccine. And my understanding is, you know, vaccines are real. I'm old enough to remember polio and the girl down the street who had polio and limped for the rest of her life, and how we all took the little sugar cubes, I think, you know. So I remember that, you know, vaccines were a very big deal in preventing death or maiming basically for the rest of your life. But I've sort of passed by the whole thing of now we have a vaccine for every illness known to man. The original intent of vaccines was to prevent an epidemic, to prevent serious illness in a population that we couldn't stop. So I think this vaccine falls into that category. Anyway, going back to what won't it do, it is not stopping the need for masks and social distancing at this time, and nobody can tell you when that's going to end. Again, because we don't know when it's going to slow down in transmission, and we also don't know about variants. The vaccine has been mutating since it showed up in China with all these little spike proteins, but some of the mutations now are beginning to really get some steam and seem more dangerous than the original one. And I think we all know about that. And at this time, the vaccine appears to still be very helpful for it, but everyone is like, we don't know where these mutations stop. So it's no guarantee that this is it and it's all over. And so you want to know, because this is what everyone calls, you know, what do I advise is in terms of taking a vaccine is we have really 2, I'm thinking very logically, there's 2 bad outcomes here. Is you can get COVID and get hospitalization and death because you have a poor immune response and inflammation. If you're over 60, your immune system is not going to work as well as it did when it's 30 because of hormones and because of the death of the thymus and other things. And inflammation, and inflammation is incredibly common. And you also have the other bad outcome here from COVID is long haul syndrome. And I think most people I'm talking to have some idea what chronic fatigue is. And we're showing, you know, long haul's not a whole lot different in a sense than things we've talked about, SARS and viruses and Lyme. It's an overexuberant immune response in many people with autoimmunity and destabilized mast cells. And this is probably where we need to spend a little more time talking about our population. So this is what we're talking about. I would say that if you know you have a poor immune response, meaning you really can't kill viruses, you're older, you're 70 and otherwise in fairly good health, it would seem you'd want a vaccine without much thinking about it. The solutions here is because I don't see how anyone really would want COVID because of the effects on the brain, on long-term effects, is we need to optimize immune systems. And remember, that's what does really protect us. And we need to decrease inflammation, so that if you get COVID, it doesn't have a chance to really start a fire going and start the autoimmunity, really destabilize the mast cells, makes the whole immune system less effective. And it's actually the major cause of most of our chronic illnesses. And you also need to continue to follow reasonable, not perfect safety precautions. And I want to just really stress this point to everyone who's asking me, should I get the vaccine? As you think about it, what's your risk? What are the benefits? There are big benefits here. Is if you're going to take the vaccine or you're thinking about it, don't ask me about like if I've just found mold and I'm really reacting and I can't eat any foods and I'm vomiting and I can't think. It's like, no, you're not stable. You don't want to take a vaccine. If I'm having mast cell, I'm having a mast cell flare. And again, there's brain fog and GI reactivity and flashes and you're really not feeling well, don't take a vaccine. You're sick and it's probably not going to work as well as it would if you're feeling in your usual state of health, which may not be perfect, but is your baseline and is the best as you can get. So that's the first thing is stability. And I just want to point out, this is what a nurse prac friend of mine sent me recently. I was kind of shocked. It's just, without even going into SIRS, EDS, mast cell, autoimmune, and everything else, is only 12% of Americans are actually basically metabolically healthy or inflammation-free. And that's measuring things, the good old hemoglobin A1C, HDL, which is cholesterol, the triglycerides, blood pressure, and waist circumference. It's only 12% fit into these healthy guidelines, and actually only 6% of us, 6% engage in what are called the big 5 healthy behaviors. Never smoking, well, we can't go back and change time, but getting regular physical activity, consuming no or only moderate amounts, normal body weight, and obtaining sufficient sleep. Well, all of us can do stuff about most of this. So we're going to talk again about getting inflammation down, keeping it down, and that's going to improve your chances, I think, here for a vaccine going well or an infectious disease if you get it. And most of you know this, you hear me talking about it, is sleep. It's one of the biggest things we can do for inflammation. So again, it's going back to my point, if you've decided to get the vaccine, get it at a time and schedule it when you can sleep. You know, don't go in when you've been up all night, either working, doing other things. You want to be stable and you don't want to go in really tired. You want your diet, and I'm saying for at least the week before, is, you know, try and be good on your diet. We all know about COVID carbs, but just as a reminder, a good diet really would be a low carb, below 50 grams, you know, really healthy fats, olive oil, avocado, fiber, you know, 20, 30 grams. Sugar and bad fats are really, really the enemy. And if you're going to ask me questions about everything, autoimmune and everything, is work with the diet, because it is going to really decrease your inflammation. Moderate exercise, you know, not overdoing it, but doing something to move your blood flow. It's probably going to help some of the issues with the joints and the swelling. Peaceful mind. You know, we talk all the time about vagal tone. I don't think sometimes people know what anyone's talking about. It's just cultivate a peaceful mind. It's try and be at peace, make your decision and go with it, okay? Obsessing about everything that could go wrong or right and looking at every piece of evidence is usually not peaceful. Try and evaluate the evidence, make up your mind, watch what's going on, and just cultivate some peacefulness. And then it's the part that I always like to bring in is just, again, when we're talking about inflammation, there's really good evidence at the genetic level, which is where all this is happening, is just remember eudaimonic happiness is, you know, having a sense of purpose, helping humans or animals or the planet, actually shows at the genetic level much less expression of inflammation. So I think that's as much as I want to say. Is I want to just emphasize again that the stability in going in to get a vaccine, if you decide to, is taking all your supplements. So the special cases here that I want to talk about would be mast cell patients and autoimmunity patients. It's pretty clear that mast cells are very involved in COVID as really contributing to the inflammation. Certainly in the long haul syndrome, we're seeing POTS, dysautonomia, which are being triggered by mast cells. So if someone has said to you, you have mast cell illness and has you on some supplements and meds, the week beforehand, take them, okay? Your antihistamine, not the time to be stopping them. And that's important. The CDC, the Mast Cell Society, their advice is take an antihistamine before you go in to get the shot. CDC is saying exactly the opposite. Don't take the antihistamine before you go in to get that shot because it might mask the rash you would get before you get anaphylaxis. I think we all know the CDC, was telling us not to mask in March and now is telling us to double mask. So my compromise and most doctors' compromise is, again, if you're already taking antihistamines, be consistent, continue taking them because they may give you some of the most benefit here for keeping your reactions after getting the vaccine reasonable. So if you're calling me a few days later and saying I'm having diarrhea and I'm having all this flushing and I'm itching all over, and it's most likely, and you have mast cell illness, is most likely it's been triggered, and my answer is going to be get back on your mast cell supplements. That's probably going to help it, and do everything else I just talked about. And again, going in to get the vaccine or just in preventing COVID, this is not the time to stop vitamin D. I mean, I've been talking about it forever and with COVID forever, but it is the most evidence-based supplement we have here in terms of keeping you out of the ICU. And alive is vitamin D. Fish oil, the best thing for inflammation. Fast starts is, and again, these are just some of the behaviors which I see when people get stressed is, I'm gonna stop doing all of it, I'm just tired of it, etc. If you're feeling like that, don't go and get the vaccine at that point. And again, mast cells and patients with autoimmunity, which would be Hashimoto's, very common, less common lupus and rheumatoid arthritis, is you want to be taking your meds and be consistent. You don't want to go into that overexuberant immune response that can happen when your immune system gets triggered. Okay. If you're asking me for perfect recommendations for this, we don't have the evidence. There's no papers I can find that will tell me if you do this, if you, do that it's going to prevent it. What doctors have been doing, again, is just if they've had allergies, they've been taking antihistamines. There is some advice now too. Maybe you shouldn't be taking non-steroidals if you're thinking, hey, I'm going to outwit that sore arm, take my ibuprofen before I go in. If you're not usually taking ibuprofen, don't do it. It possibly might decrease your immune response. However, it seems to be fine to take like 30 minutes afterwards or 6 hours later if it's starting to get really sore, the arm. Okay, and I'm just going to go over again some of the supplements to take. This is some changes to the regimens that I may have given in March and July, all of which have worked and of which I have, I should probably tell you the good news is, again, we're living in a state with 1 in 10 people have COVID. My statistics of my population, my active population, which is probably about 500 to 1,000 patients really, because I have people calling me up from 5 years ago who like, oh, I have COVID, what to do? They consider themselves patients. So I can't say only for like the last 6 months or so, is I think we have about 12 people who we know have had COVID. And again, nobody hospitalized, nobody dead. So my statistics, I think, are really beating Arizona and speak mostly for my patient population. Taking normal safety precautions, they, are doing what they think is necessary. Most have been doing supplements, some before COVID, wearing masks from before COVID hasn't been a problem, but something in this combination seems helpful as compared to the general population. So That's the best I can say. And other doctors who do similar things will tell you the same. We are not seeing the same amounts of COVID of hospitalization and deaths as the general population where inflammation is running rampant. So if you're on vitamin D, which I've advised every patient to be on vitamin D, do not forget your vitamin D. And if you think you have COVID, double your normal dosage. Whatever I've said, hey, your numbers look pretty good here, just double it for 3 days if you just got a positive COVID test. Then drop down. And again, if you're not doing vitamin D, get back on it. That would just not be a great idea. And zinc, again, if you've told you need zinc and you've gotten that positive COVID test, is just double your dosage for a week. It really does seem to help. And if you're not on zinc, I would, after you've been diagnosed with COVID, start 30 milligrams and continue for a week. That's very safe, but still could be helpful. Quercetin, very big mast cell supplement. Many people I have on this, as do others, is you should be taking, if you have mast cells, certainly the week beforehand. And if you found you have a COVID positive test, is make sure you're taking the quercetin or quercinase, whichever variety you're on, like 500 milligrams 3 times a day. And that one you may be continuing for a month. Several patients have told me they thought that was the most helpful thing for them. They felt that was really helping inflammation. Vitamin C, very common recommendation. I say to bowel tolerance, which means don't overdo it, to diarrhea. And 1,000, 4 times a day is often recommended. You may want to just watch again, whether you're getting diarrhea or not. Melatonin, very helpful for the inflammation we see in COVID. Everyone should be on it. At least I've tried to get most people on at least 3 milligrams by now. And whatever you're on, because I have some people on high dosages, and is double it if you've had the positive COVID test. Should mention one of the side effects of high dose melatonin, it turns out, is fertility. And we do have a COVID baby coming who's been blamed on melatonin recommendations. So just be aware that is a side effect. It's used in fertility clinics, it turns out, in Europe at high dosages. Vitamin A, I've had people on vitamin A. 10,000 is reasonable. If you're taking a lower dosage, just go up for 3 days. It's very directly antiviral. Transfer factor, I have a lot of people on. And again, I would just double it or triple it if you've been told you have a positive COVID test. Don't have it on here, I really should, is you should be on a baby aspirin, is to prevent clotting. That seems to be enough for most people to prevent clotting issues from happening. So you should add that. If you have it, red sage bacal, half a teaspoon twice a day, really helpful. I think I've had maybe two people at least who found out they were, who are on sage bacal, found out they were COVID positive only through work. They had a test and found they were positive, and we increased it. Their symptoms were really mild to maybe non-existent. I like red sage bacal a lot, but a lot of people don't like herbals that are liquids. But if you're on it and like it, keep going. And something I did want to mention for everyone here, because I've talked about it so much over the years, is again, cleaning your nose. This is how it comes in. It turns out aerosol transmission is clearly the major route for COVID, is using Xlear. Every drugstore, Amazon has it. It's xylitol, comes in a nice spray bottle, and using it 2 squirts each nostril twice a day. Certainly when you come back in, taking off your mask or you feel you might be exposed, is just wash your nose with the COVID and start to get some real discharge from your sinuses and nose, blow your nose. The reason is it's been found, good old Xlear has been found in a test tube to kill COVID. Okay, so doesn't mean it's going to kill it in a human, but there are trials going on. And it's so easy to use. So many people are already using it. That might be the best recommendation I'm giving you here, is just keep using that every day. And that is the end of the short talk I planned, and I will take some questions about other things. I've not mentioned every supplement possible, everything, every complication possible, and I'm going to try and keep it general and hope that people, in answering your own questions, because really, you have to make your own choice here about the vaccine, is that in making that choice and deciding what you want to do, taking into account everything I've just mentioned. So I'm going to look at the chat here now to answer some questions. And I need to, I'm sharing my screen here. So I'm going to stop the share for now and go back to looking at Zoom so I can see everybody and find chat. Okay, we have a lot of questions. And if you have questions, put them in chat. It looks like that's where everyone's questions went. Is the sound working? Yes, hopefully. Yes, yes, yes. Okay. Refresh. Okay, I'm going to those of us on autoimmune or anti-rejection. Should we get the vaccine? I hope I answered that. I think your best prophylaxis for most people is going to be really sticking to your diet, the sleep, all the supplements, certainly all the mast cell autoimmune supplements. And, you know, if you have a diagnosed autoimmunity, you have a rheumatologist, an immunologist who you're working with. Some people really are immunocompromised on CellCep. Talk to them too. But I've yet to hear any doctor here saying locally or in the country really, you know, don't take it because you have rheumatoid arthritis, don't take it because you're on CellCep, don't take it because of this. Is that, again, the rewards is we know what happens if you don't get the vaccine, is pretty much what most doctors say. So and the other prophylaxis is, I know some people have suggested, should I take monoclonal antibodies? Well, I'm not sure how you're going to get that, but if you have some access to it in order to get the vaccine, sure. But in general, they're very hard to get. You get it really only if you have COVID and insurance. Hopefully I answered the COVID positives. I think I gave you a really good list. This is exactly what I recommend here for you. The protocol, you had the Moderna yesterday, and I have an autoimmune condition. My arm was very sore, absolutely expected, less so today, totally on target. That's all. You seem to be totally on target, whoever this question is. I don't have names on these. That would seem to be, from what I've told you, exactly what to expect. Yes, and I think I've answered this. Yes, it seems that taking it, and I'm not saying take it the day before, I'm saying take it a week before, you know, be stable, be consistent, don't start having reactions to something you're taking to prevent reactions to the vaccine you're trying to get. Make sure that this is working for you and you're stable before you go in to get it. What if you're a long hauler, always symptomatic, could possibly have COVID hiding in the brain? Okay, somebody, and other places. I didn't talk specifically about long hauler. I will say that every long hauler I've been seeing so far has not been as well as they thought they were when they got COVID. Is that we're going down the usual treatments for chronic fatigue. Mold is pretty common in people who are long haulers. Autoimmunity, mast cells, probably Lyme. Is that working with chronic fatigue? I have not seen a magic remedy. I have seen a lot of people helped by sleep, diet, the Some of these supplements I said for COVID are going to be very helpful, like melatonin, vitamin D for the inflammation afterwards. There may be some more specific mitochondrial supplements that are helpful. And we're all learning more. I know a lot of other people in this group would like to say welcome to whoever this is, unfortunately, is nobody thinks this is a new illness. And the New York Times this weekend had the best article I've ever seen on chronic fatigue, which they're calling it long COVID / MECFS / chronic fatigue, and just showing how for the last 100 years, this has been known. We've had groups, it certainly is related to post-viral, the Spanish flu. And so it's just finally actually getting taken legitimately. It seems to have taken 100 years. You know, when I first saw people, it was called the yuppie flu. And before then, just psychosomatic. And I think most people here have had some sort of psychosomatic term. It's finally, it seems, being recognized. There are clinics now up around the country. Most of them are going to say they're looking at dysautonomias, POTS, mast cells, as many of the reactions they're seeing. Okay, this was about the, you know, does the vaccine affect reproduction? Is it definitely not true? We do not know anything definitely about the vaccine and reproduction yet. I will tell you a number of doctors have really sat down and thought about it and made the decision to get it while they're pregnant or breastfeeding because they've looked at the risks. No, we do not know to 100% it's not going to affect it. However, COVID is going to probably affect it just as more. It's just you're getting a small piece of the spike protein, which we think is less harmful than getting the whole COVID virus. So you have to take that into consideration. And I wish I had a better answer. Been hearing more and more about long COVID. Yes, and you will hear more and more about long COVID, fatigue brain. Do you think it's possible these therapies, I think I've answered that a few times, is absolutely. I think the doctors treating are people like me and others who've been treating chronic fatigue for a while and see the similarities right away and know where to at least start here. May I record some of this? Well, probably did already. It's fine. We're going to have it on our website and probably there'll be it on other websites too. And it's just, remember, it's my perspective of how to approach this. It's not direct medical advice. Everyone's going to have to make their own decision about how to do it. And somebody asked about the antibody test, if they got it at the GEM show last year. In general, the antibodies seem to last for 5 months. And the antibody tests are pretty good. And you can try them, but if a year ago, it's very unlikely they're going to show. And this should just go into one question is, if I had COVID, does that mean I have immunity? Maybe, maybe not. That's the best we can say. It's not clear how effective those antibodies are like 5 months out. People are clearly getting COVID for the second time and should take that into account when you think about your risks. Recommend not starting any new medications. Absolutely, somebody heard me here. Be stable, be consistent, not the time to try something new, to go into a herx, to start to react. It's just be the best health possible. Get good sleep, eat well, get some exercise, and have a happy mind. It's like, I can do this, I want this, and you're probably gonna do a lot better. Yes, so I've answered that, I think, multiple times, is don't start something new before doing this. How much baby aspirin? 1 baby aspirin. Some people just take a full aspirin and cut it, I think, in quarters. We use nattokinase a lot, nattokinase with pycnogenol, which is a really potent antioxidant. That's another anti-clotting fibrinogen. But I'm trying to give really easy advice, because usually when you get COVID, it's not when you expect it and not when you're sitting there maybe with all your supplements and ready. Most people would like and have appreciated, even if they're really bright and know everything, is like, here's a list of things to do and I'm going to start doing them. And then maybe tomorrow I'll remember 3 more things I should have done. So this was meant to be a simple list of things you could get easy access to. Do peanuts introduce mold into your system? That's a complicated question that probably is not really part of this. Is yes, they do have aflatoxins, which are a mold, but it's not necessarily what we mean by mold illness. Boy, a lot of long hauler questions. I'll come back to that, okay? And I think I'll be writing more on blogs, because it certainly, you know, I knew immediately that of course this would be affecting the brain because it has it in the past, and that we would be seeing, because we've always seen post-viral illness. So it is an area I'm interested in and am seeing patients. You know, this whole thing is like, well, trying to game, if you have mast cell, if you have autoimmunity, should it be Pfizer, should it be Moderna? And it turns out we all thought Moderna would be better. Then there were more allergic reactions to Moderna. So we may not be able to predict. And a lot of doctors' answers is right now, it's the best one is the one you can get. So I would have said, yes, Moderna was better. And I did say that to a few people. And then it turned out maybe Pfizer was the better choice. So I think I'm going to kind of keep my mouth shut anymore about which one's best. And is there a PowerPoint available? We'll probably make this PowerPoint available as a PDF on our website with it, so you can look at it, so you can just reference it. And can I talk about monoclonal antibody infusions? I think I did. They're helpful. Everybody's going to get it. If you get COVID in Arizona, that is part of the protocol. They are actually still low-level evidence. If you look at the FDA website, it's still listed as, you know, they're neither for nor against, yet we kind of have our hands tied on what are we doing. So we will get them. I will, is it a substitute for the vaccine? There's no evidence that it is. There's no evidence that that antibody infusion is how long it's even going to last in terms of protecting you against COVID. The antibody infusions, you're talking antibody infusions would be more what I think what we call convalescent plasma, which is again a bit controversial, but is meant for you to use someone else's antibodies to help your body. And again, your body may destroy them, they may be excreted. It's not certain how long they last. Then there's also just the monoclonal antibodies that are essentially working with inflammation. They're not necessarily for protection against the virus itself. And those are the 2 treatments we have, but are still fairly low-level evidence. And absolutely astragalus, that's in transfer factor. You can get it separately. That's exactly the kind of herb you want. That's going to help improve the ability of your immune system to kind of direct kill, to get your T cells to work better. We don't have no idea if Johnson & Johnson is safer. The vaccine makers have, you know, not been shown to be dishonest in their data or anything. I don't have any reason, and I haven't seen many people, doctors, talking about it yet. We're all just trying to keep up with the 2 we have and the reactions we see. The person who is positive and negative, that's a wonderfully great debate. Did you really have it or not have it? With the positive, was it a false positive and you were really negative? were you really positive and you had very little, were making very little viruses? I think most people would go with what I just said. You were not a super spreader, and you probably had, yes, a very good immune response doing all the supplements. And yeah, that's the kind of response you want is, and you're not saying you're a long hauler or that, you know, you were mild, but now you've been in bed and haven't gotten out and your brain doesn't work. It sounds like whoever wrote this, you did pretty well with the supplements you're taking. If you've been told to never get the flu vaccine because it literally killed me by 2 naturopaths, you're going to have to make your own decision and perhaps read through again. It is not the flu vaccine. It's not an attenuated vaccine. It doesn't have excipients. I'm not giving individual medical advice. And I, you know, would go back and ask the 2 naturopaths who never told you this what their opinion is. I can't, you know, look back and see why they would tell you this or what were the reactions for it. And again, the flu vaccine is not the same as messenger RNA, nor does the flu vaccine, you know, I've certainly argued in the past to many people, it's not particularly efficacious if you look after the fact of what people are given and how efficacious it was. This is a very different ball game. And someone said, I survived COVID in June. I did everything Dr. Mary recommended. Good. Hopefully you weren't hospitalized and you're certainly not dead. But would the vaccine be safe for long haulers? There's some argument to be made the vaccine might be really good for long haulers. This is one argument, and I've seen it made, is that some long haulers getting the vaccine have actually found the vaccine, and again, this is anecdotal, have found that the vaccine, they felt better, and most people, doctors are thinking their immune system got enough of a boost to find some of this hidden virus and get it. So realize that there can be some positive reactions, no guaranteed. I'm sure there are some long haulers with autoimmunity and mast cells who've gotten the vaccine who haven't felt well and didn't go into it feeling very well. But there certainly are some reports of long haulers feeling it helped their immune system. Yes, with the continually mutating, there are a lot of different variables that nobody can promise you very much. I don't know about the Johnson & Johnson vaccine, whether it's going to be better or worse. It is different. And it's just one of those things, when you've had 20 million people, you have had a lot of people taking it. Johnson & Johnson's had nobody, you know, they've had their test subjects and some mice. So I think at some point we can discuss theory, but you'll get a chance to see with people. What is Pott's mast cell? If you don't know it, good. You don't need to know it. You could ask probably the other half of this audience what Pott's and mast cell is, but it's, and if you've seen a doctor, they should have diagnosed it. Yes, I think someone's making the point. I don't know why it's hard for me to read these, is the, that if you've been exposed, you need to tell anyone you've been within 6 feet in their presence for 10 minutes. That would be lovely if you did that. Whoever said this is, yes, this is the advice. I will tell you the contact tracing program is almost non-existent. That's how, one of the reasons we've gotten to 1 in 10, because that part has either not been possible, not taken seriously at all at many, many levels. Yes, it would be very nice of you to tell people if you test positive, you've been close to, that you're positive. And the, I think someone's asking what it means about recovered, what happened to these other 10 million? No, they're not all dead. is they're probably still in the hospital or have not been reported recovered yet. A lot of people are in the hospital for a long time. So I think that's what it probably means. And oh, here's a good one. If someone in their 20s had a mild response when they had COVID, then tested negative for antibodies, first question is, did they have it? Might take time for the antibodies, but you should see antibodies if you really had it. And this is a whole question. It's not as bad as Lyme, but our testing is, not perfect. And this is an interesting question. So then if you get it again, do you expect the same reaction? Maybe, maybe not. It may be a lot more robust, as your immune system may, at that point, attack it more vigorously. And sometimes that leads to more inflammation. Okay, and then people have asked about ivermectin. And I did want to just mention that ivermectin has about the same level of evidence as monoclonal antibodies and convalescent plasma, which means fairly neutral. The FDA is neutral on it now. It's not saying it helps, not saying it doesn't help. I have used it on a few people who've told me. I haven't seen the dramatic responses other people have told me. If you have it, we can get it. And it's one more thing to use. I've been asked, someone called asking about some very serious side effects with ivermectin in the blood-brain barrier. I don't have any reason to think that that's an issue. This is used like once a week at the dose we use for scabies, and nobody who's doing it is getting serious side effects. And I also have to say, I've had a number of patients, some of you may know, who've used it over the years for their own parasite protocols for much longer and at higher dosages, and we've never had severe side effects with blood-brain barriers or brain issues or CNS depression that anyone knows of. So it's been a lot of self-treatment with ivermectin over the years, and do not use the stuff from off Amazon for fish or goats or whoever it's for. Okay, so I think we've gone through 7, and I know there are a lot more questions, but I think I've given you the best advice I can here for all of this, that of how to think of it, to be stable, be consistent. We cannot answer every question or tell you with 100% assurance you will be absolutely safe and have no long-term effects. We can tell you at this point with absolute assurance, if you get COVID, your chances are fairly high. If you end up in a more serious condition, you will have long-term effects, or even if you have mild COVID, that you may have more long-haul effects. So that part is what you need to understand. And then after that, there's no judgment. I think there's no talk of forced vaccines. They're talking about not finishing the program in Arizona till like August, I think, of getting vaccines to everybody. So, okay, I think that's it, because I have answered a ton of questions here, and I'm going to turn it back to you to all to be able to talk about this and mold. Remember, this mold, and mold does have a lot in common with it. And I'm just looking for where I turn off the recording part. So lost that control here. So anyway, as soon as I can turn that off, or maybe Anita can help here. I don't think she can turn off recording, but she can let others talk and chat here.
Thank you, Dr. Mary. We really appreciate your taking the time to address all of us. Your words of wisdom have been very enlightening, and I think a lot of us have had many questions answered.